We also know right now so many people, obviously, back to work, back to school, but we really have this increase in respiratory illnesses.
Yeah, that increase is not going away anytime soon. And not surprising, as we all predicted, after that Christmas New Year's break, the numbers of respiratory viruses, not just RSV or flu or COVID, but an entire smorgasbord of viruses is now increasing. So if you had kids in school and you walk in the hallways or listen to them on the bus, all you hear is coughing from everybody. If they're over your house, you hear coughing all the time. That coughing and that spread of viruses is not going away anytime soon. The important thing for us to remember is that if your kid is coughing, maybe it's okay to encourage them to wear a mask while they're on the bus and in school so they don't get their classmates sick. Maybe it's okay for a teacher who's coughing to also wear a mask. And that's what the New Jersey schools are doing. They're asking for everyone to wear a mask. So maybe that will cut down on how many kids are spreading viruses and cut down on absenteeism.
Now it's that time of year where a lot of people make those New Year's resolutions and they
Oh,
say,
yeah.
okay, I want to eat better, I want to be healthier. But is there kind of a checklist of things that we should be doing, throughout the year to make sure that we're healthy? Things like our blood pressure or, getting screened for diabetes. What are the things that we should be doing to make sure we are healthy?
So I think it's being smart about yourself, making the appointments that you needed to make. Are you old enough to get a colonoscopy? Then schedule it. Don't push it off and say, oh, next month, next month. Call the physician, schedule your colonoscopy. Do you need a mammogram? Call it and schedule it. Don't put it off. These screening tests are very valuable. They work, they're accurate, and they're very useful. So I guess the advice to everyone is take care of yourself. We need you healthy. The gym membership, oftentimes people make lots of memberships in January and February, and then by April, they're gone. But your visits to your primary care provider are important. And those are the things that you should schedule now, even if it's for 2 or 3 months from now. That's okay. Make those appointments.
Absolutely. And I know we spoke with another doctor that was talking about really trying to integrate maybe some of the new technology you have with keeping yourself healthy. Let's take a listen.
Get a blood pressure cuff at home. You have it linked to your iPhone or your smartphone, so it'll record the pressures. Know your medicines. Keep a list on your smartphone. Know what they are, why you take them, what the side effects are. What's important? What you eat. Next is how much activity you have, physical activity. Next is your sleep. That's one of the forgotten risk factors.
And I do think about that, the need for sleep and for your body to really restore and recover, Dr. Nachman.
Right. And I worry a lot of times about parents using sleep aids in young children. I want to encourage them to say, why is your child not sleeping? Is something going on at school? Is something going on at home? Are they not getting enough activity? I'd rather you look at those reasons for not sleeping as opposed to just going ahead and giving some melatonin. That would be sort of a better choice. Occasionally, melatonin is useful and it does help, but to use it every night, we really don't like that.
We do know a lot of people decide to do this dry January, after they ring in the new year, they say, okay, I want to try for this month to just abstain from alcohol. And they came out with a study and it shows every year tens of thousands of people do take part in this dry January. And it's really kind of a test of willpower. But according to research, it shows that people that did this had some really lasting health benefits.
Remember, alcohol is a very high caloric drink. So having a dry January, I want to say, is even more exciting or healthier for you than stopping soda as well. All of those drinks that have high sugar, high caloric contents are giving you extra poundage. So after you've been drinking a lot, perhaps between December 25th and January 1st, abstaining from alcohol for a month is a great idea. It'll help you get those extra pounds off.